Hello, I'm Dr. Richard Schumann. I'm a neurologist and sleep specialist. I've been practicing in both of these fields for about 18 years now. I'm really excited about working with Nitetronic and developing new technologies with regard to the treatment of snoring. It is associated with things that are much more dangerous, like high blood pressure and heart disease and stroke, and I think this entity will allow us a new treatment, a new weapon in our armamentarium in treating primary snoring, which is a very common, one of the most common sleep disorders.
So it's very typical in your practice, obviously, to look at data that's been recorded from your sleep studies, whether they be in your lab or at home. In terms of an anti-snoring pillow, how much value would it offer to you and your patient to actually see data that's been recorded by using a pillow that's intelligent or smart through, let's say it's an app?
Yeah, I think that's it offers a tremendous advantage because a lot of times we are looking at data that's self-reported, and in this way we have things documented based on metrics that we measure in terms of sound and position and the amount of snoring that's taking place, and having an objective measure like that, just like we would have an objective measure in an in-lab sleep study or a home sleep study, is a tremendous advantage. What impact does snoring have on family and individuals? Well, certainly it has a detriment if it's causing sleep disruption in the patient who is having the snoring. Sometimes it's worse when they're on their back, but it can occur in any sleep position. Many times it's the bed partner or spouse who recognizes that snoring is part of not only disrupting the patient's sleep, but disrupting their sleep.
Can you talk a little bit more about what happens to a family that someone's complaining about snoring? Do they end up sleeping in different parts of the house, or what impact does it have on their social interaction with each other?
Yeah, it certainly does affect them socially. It many times leads to patients sleeping in another room or even on the couch, which is a suboptimal sleep environment. So it impacts their sleep in that way. The fact that it's under-recognized and under-treated is a big thing that we have, misperception that we have to let people in on and know about, because it's not a cute or quirky thing. It involves, it is associated with other more serious disease entities like heart disease, hypertension, and even stroke.
So at Performance Sleep Centers, which you operate and you're the chief medical director here, you get referrals from primary care physicians, I'm assuming, and of the patients that you see, what percentage of them, after you talk with them or do a study, their primary issue is snoring versus sleep apnea?
I'd say at least 25% to a third of patients have problems with just snoring. That can lead to insufficient sleep or sleep disruption. Snoring can make you wake up just like stopping breathing, and in both cases that fragments the patient's sleep and leads to less efficient and less restful sleep overall. In terms of treatment options for snoring, appliances that could be fabricated by dental sleep professionals, other entities involved, even minimally invasive upper airway surgery, either through traditional methods or through laser.
There's other options out there too that I know that you've explored and looked at in the positional kind of therapy thing. For instance, like an interactive, maybe anti-snoring pillow. Could you comment what's your thoughts on that?
Well, I think this is an exciting new chapter in our treatment. Certainly, snoring can be, in many cases, positional, and that's where we can directly affect the width of the upper airway, the position of the jaw, and I think this allows us to do that on the fly and treat this going forward from breath in as little time as breath to breath, and I think that's going to be the next evolution in terms of our combating snoring to a large extent. These pillows are not just positional, but they help change the position of the head, but not only the position of the head, but also the jaw and the face. And I think all of these together, I think, are going to be modes of attack, and I'm excited about being involved in that and trying to see where we can make improvements in technology to improve people's sleep.